Hello again, Lake Charles. Russ Silver is here, your CBS Eye on the Lake guy. This is another exciting, informative, and entertaining, I think, edition of Doctor on Demand. This is Jarrell Zeno. That name sounds like a superhero.
It is.
And so this is our physical therapy superhero at MAXX Physical Therapy. You are a physical therapy assistant.
Yes, a physical therapist assistant.
Let's talk pre-op and post-op. Let's say that you're going to be having some kind of a joint replacement, knee replacement surgery.
Mm-hmm.
What should you do before that happens? Can you give any advice to people when they're thinking about having that done?
Well, a good thing to do would be to do as much research you can on the procedure that you are about to undergo. Speak with people who've had that surgery and, just try to collect as much information you can about the surgery and about the rehab.
It sounds like you're saying you want to find out what reasonable expectations for recovery is.
Yes, absolutely. Absolutely. Because everyone has a different experience.
Yeah.
So,
living things are totally different. Every living thing is different.
Absolutely.
Right.
Absolutely.
Right. Some people can have their wisdom teeth taken out and they're at work that afternoon. Some people are going to have to be laid up for 2 weeks. It is different.
And it's the same way with rehab. Okay. The same way with surgeries.
Okay, so if I'm going to be having some kind of surgery, is it a good idea, a bad idea, or to go ahead and schedule your physical therapy right then?
I think it's a good idea to go ahead and once again, that's being prepared and knowing what's ahead of you. Good idea. And we have some people who also schedule rehab before their surgery, which is called prehab.
So prehab?
Prehab.
Okay, I've heard of rehab. Prehab, you're just making up words, aren't you?
I am not.
Okay.
I am not. Prehab is a real thing.
Okay, what is
it's a real thing.
It's rehabilitation before, what is it?
Absolutely. It's like a preemptive strike. So yeah,
okay.
It helps. The advantage of prehab is that it can help strengthen those muscles or kind of help build those muscles up before you have your procedure, which could lead to better outcomes after, your surgery.
So it's like prepping your body for the surgery.
Absolutely.
Okay.
Absolutely.
Now right, before you paint a wall, you prime the wall. This is like priming for the surgery.
Man, you got it.
All right. Is that exactly right?
That's right, man. You got it.
So you're going to do prehab, and then you're going to do rehab afterward. Mm-hmm. And you're going to you're going to talk to your doctor. He's going to say, well, you have after the surgery, roughly 2 weeks. So they're going to talk to you and say, by the way, if they want to talk to you, how do they schedule this stuff?
To get started with us, it's very simple. You could call or you could come in, and we have a great office manager. Her name is Erin Reyna, and she can provide you with all of the information, answer any questions that you may have, So come see us at MAXX. We'd love to meet you and welcome you into our family.
Okay. So you had surgery and you're coming here for physical therapy for rehabilitation.
Yes.
Is it painful?
Yes. Sometimes it can be. Sometimes it can.
You're not being a very good salesman.
I'm being honest.
All right.
Because I rather know what you're getting into and prepare for that. Some surgeries are more painful than others and everything. It's not the rehab. I don't feel like it's the rehab that's the most painful part. It's the surgery that happened, and you have to remember that. Like I said, I tell people this all the time. Someone took a knife and cut you open and had to fix some things in there.
Yeah. So
what we do is try to repair those things that were cut and, those things that were fixed. So yeah, there's going to be some pain sometimes associated with rehab, but it's not going to be anything that you can't handle.
Yeah, I'm thinking about this. Let's say someone has a discectomy. I'm just thinking back surgery. So you're going to do the physical therapy not only to help mobilize again that area that was corrected, but they also, to get to that disc, they had to go through your skin, they had to go through muscles to get to that. You're going to help with that as well.
Yes. So we also help with pain relief. We don't just cause the pain. We also help relieve your pain that we cause.
Well, you always hear on the T-shirts of the bodybuilders, no pain, no gain. There's some truth to that.
There is some truth to that. That's not always the best barometer to use.
But the idea is to get through the pain.
Certain pain, yes.
You want to get through the pain, because there's going to be, so you would rather somebody experience pain for a short period of time than chronic pain for the rest of their life.
That's exactly right. That's why we're here.
Excellent. This is Jarrell Zeno again. He looks like a superhero. He's got a name of a superhero, and he's going to turn you into a superhero here too at MAXX Physical Therapy.
Absolutely.
I would be afraid. You're like a drill sergeant out there, aren't you?
That's what they call me. That's crazy that you knew that. That's exactly.
I can sense it, and he feels like he's been lifting Volkswagen. So
and everyone sees me and they're scared. They're like, I hope I don't have you today.
And then he smiles.
I'm not the one. I'm not the one. It's the girls you should be afraid of.
That's true.
They're the ones.
They really are.
I'm the teddy bear. I'm the teddy bear.
So come to MAXX Physical Therapy and see your personal teddy bear or one of the mean girls. That's what he said, not me. We'll see you soon on the next episode. This is Russ Silvers, your CBS on the Lake guy. Stay healthy.